So a very warm welcome everyone to our very first Good Practice Power Hour. My name is Alexia Rhodes. I'm the Learning and Network Manager at the Greater Manchester Good Employment Charter. So the Good Practice Power Hour is just a chance for you to hear examples of good employment practice from across our employer network, and a chance for you to kind of be inspired by these practices and perhaps implement them in your own organisation. So we are joined by three speakers on this session. So our first speaker is Rebecca Lawton from Koderly, who's going to be talking about flexible work. We're then going to be joined by Anna Callaghan from Talk, Listen, Change, who'll be sharing a piece of practice around health and wellbeing. And then we'll be hearing from Elaine Johnson at Great Places Housing Group, who'll be sharing a piece of practice around people management. So just a little bit of housekeeping from me, and then I'll hand over to the speakers. So in terms of housekeeping, at the moment, you'll have seen that you're all in listener only mode. If you do want to ask a question or have your camera on, please let us know in the chat and we can do that for you. This webinar is being recorded so that we can upload it onto our website and YouTube channel afterwards for playback. You'll see there's a question and answer bar at the bottom, or it might be on the left-hand side for some of you. Please do ask questions throughout the webinar. We'll answer them all at the end, just so that we've got time. And there is a reaction button at the bottom as well if you want to react to anything that people are saying. So that's all from me. I'm going to hand over to our first speaker, Rebecca, who's going to be talking about flexible work. So over to you, Rebecca.
Thanks, Alexia. Hi everyone, I'm Rebecca from Koderly, so I'm the Head of Partnerships and Marketing, as Alexia has said. If we can just go on the next slide, yeah. So just a bit of background about us. We're a software and services company in Oldham with over 23 years experience working with market-leading brands. Our main services include software development, digital transformation, and database administration and support. So at Koderly, we have more than 20 employees split across software development, project management and business analysis, administration and marketing. And we have been a supporter of the Good Employment Charter since its launch in 2019, and we thankfully became a member last year. So we introduced our flexible working policy in 2019, and it's been proven to be our most valued benefit. We introduced a scheme to give our employees control over their working hours so that they could decide when and where that they work, which would then improve the work-life balance. To achieve this, we did need to implement controls to the flexible working policy. If you could just go back a slide, sorry. Thank you. So that we could support all of our employees. So for example, we didn't want employees working too many hours in a single day or week. And we also didn't want employees working late into the night, which can be quite common amongst developers. Just go to the next slide. So before I go into the details of the policy, I just wanted to talk through some of the challenges that we needed to overcome before we implemented it. So it needed to work for both employees and the business. So firstly, we provide support services to our customers from 8 AM to 6 PM, 363 days a year, which takes into account Christmas Day and New Year's Day. And we needed the policy to allow us to continue providing excellent support to our customers, and to also make sure that we fulfilled our contractual obligations. Secondly, different teams in the business have different requirements. I'm sure this is relatable in many businesses, especially the ones that I've spoken to recently at the last Good Employment Charter event that I went to. For example, our developers provide support services directly to our customers, which are subject to service level agreements, and that include response and resolution times. So we need to make sure that we always have development resource working during our core hours, which is 8 AM to 6 PM. Although our project managers also work closely with our customers and need to be available and responsive, they aren't subject to service level agreements. It's also a smaller team, so we didn't want this to affect their flexibility or autonomy. And our admin and marketing teams are not client facing, but they do play an important role supporting the wider business. And again, the smaller teams, we didn't want this to affect their flexibility or autonomy. Different colleagues also have different routines and working patterns. Some prefer to work early, whilst others prefer to work late into the evening. And we all want to avoid commuting at rush hour if we can do. Not that it affects me too much, as thankfully I live 10 minutes from the office, so I can go in when I want to. And finally, allocating sick time still remains a challenge, but I'll talk about this more when I go on to continuous improvement. Next slide. Yeah, thank you. So this is what our flexible working policy looks like today, and it's continuously been changed over time. So our employees can work 35 hours from 7 a.m. to 9 p.m. on weekdays with a maximum of 10 hours each day. So this lets them condense their hours into a 3.5-day week if they wanted to. But it's quite rare that we see that, because obviously they'll be doing 3 10-hour days. It's quite intense. So more commonly, people will choose to work a 4 or a 4.5-day week. To make sure that we effectively support our customers, we designed a shift system. So we assign 2 5-hour shifts to the development group each weekday. One shift starts at 8 a.m. and a second one at 1 p.m. On average, there's probably 1 shift per developer per week. They are also able to swap the shifts with each other. So they may have weeks where they don't have a shift, but further on down the line, they might have 2 shifts in 1 week. That's completely their choice. The remainder of the time, they can work flexibly. The project management team have 1 5-hour shift on a Tuesday, Wednesday, and Thursday, which covers our core business hours, and make sure that they're available when needed. So again, this is 1 shift a week, and everyone else, including myself, has complete flexibility. So following COVID, we introduced a hybrid working policy. To encourage mentoring and collaboration, employees need to work 11 hours in the office each week, and there are no set office days. So as employees can only work 10 hours a day, this ensures that they go into the office twice a week. Obviously, when they choose to go into the office, it's completely up to them. The rest of the time, they can work where they feel most productive, whether that be at home or at a co-working space or anything like that. Employees must take the required break time, but even this is flexible. We used to have a 1-hour lunch break, but we felt like it extended the working day unnecessarily. Employees now have complete flexibility over their breaks, as long as they take the legal minimum of 20 minutes every 6 hours. And we've had field days for as long as I can remember, and I've been with the company for over 7 years. So they have predated the flexible working policy. However, we did keep them in place to provide that extra flexibility. So SHIELD stands for Stuff Happens in Emergency Loo Day. So employees get 1 SHIELD day per month, and that will extend their working week into the weekend. So if on a Tuesday, quite a common one is that somebody's had a really bad night's sleep and they don't feel like they can work that day, they can volunteer to work a weekend instead, and then they'd get that day off that week. And then that protects the holiday allowance. Since we originally implemented the policy, we've made various changes based on employee feedback, and we continue to ask for feedback and look for opportunities to make it better. We do this with regular one-to-ones with directors, quarterly employee meetings, which anyone can attend, and they are employee-led, and our annual wellbeing survey. So some of the changes that we've made since implementation, our earliest change was that we initially intended to restrict the working hours to 8 a.m. to 9 p.m. But we opted for an earlier start time of 7 a.m. To support colleagues who prefer to start work early in the morning. Before we introduced our flexible working policy, we limited working from home to 2 days a month. When we originally implemented it, we removed the working from home entitlement entirely, as we thought the flexible working policy provided a bigger benefit. However, this did not go down well with employees, so we quickly reinstated it. Obviously now it's much more generous at 11 hours in the office per week. At the start of the policy, however, after time, we felt this unnecessarily reduced autonomy and flexibility, and we removed or reduced the number of shifts. Originally, everybody would need to work a weekend or bank holiday because obviously we're open 363 days a year. So that would average about one weekend a month, a Saturday or a Sunday, and they would be required to work from the office. So doing a weekend shift would reduce the work week by 2 hours. So we'd only need to do 33 hours that week. And the time that you did work on that shift would count towards your hours for the week. So if you worked a Sunday, you would get the following Friday off. Following COVID, we made a change to allow people to then work weekend and bank holiday shifts from home. Then we removed the requirement to actively work on weekends and bank holidays, allowing employees to simply monitor the support mailbox and answer the phone if it rang, and we still retained 2-hour reduction in working hours. And our most recent change is that we are now trialling a voluntary support mobile system, which provides more flexibility, and we are also compensating employees for providing support on weekends and bank holidays. And as I mentioned at the start, allocating sick time still remains a challenge, and we're not sure that we've fully figured it out yet, but we are still trying. So it's a little complicated, but on implementation, sick days could be taken in half-day blocks. So employees that were sick on a Friday may still have 10 hours to complete of the working week, and therefore we'd need to allocate them a 10.5-hour sick day. And employees that are maybe sick on a would get a 7-hour sick day because they could still complete their hours for the week. However, they may have actually intended to work 10 hours that day, and now they need to catch up on their hours and still might not be feeling 100% better, and that would then have a negative impact on well-being. So we now employees to take sick time in 1-hour blocks instead of half or full days. Sometimes employees might feel unwell in the morning, but they feel better later in the day and they'd rather work and get their hours completed. Or they might start to feel unwell during the day and they'd rather just take maybe 2 hours of sick time. So the policy has benefited our employees and the business in different ways, but overall we're pleased that it continues to meet our original objectives. The policy provides our employees with autonomy and flexibility over their working hours. It encourages a healthy work-life balance, allowing employees to attend appointments, manage personal commitments, and take extended breaks during the day, whether they want to exercise or relax. This all helps to reduce stress and burnout, which then feeds into the business benefits. So we have seen an increase in productivity as employees are refreshed and motivated, and they can work when they feel most productive. Our retention rates have always been good, especially for the tech industry, but the policy has improved this further, helping us to retain experienced staff, increase expertise, and improve quality. And we have also reduced sickness and absence, and overall the policy has helped to improve staff morale. So during our annual wellbeing survey, when we asked employees if they valued the flexible working policy and if they had a good work-life balance, 100% rated highly. That's everything from me.
Fantastic. That's lovely. Thanks very much, Rebecca. Yeah, they have a fantastic flexible work practice. And as she mentioned, they did speak at our recent Share and Learn session. So now I'd like to introduce Anna Callaghan from Talk, Listen, Change, who's going to be talking about their health and wellbeing practice. So over to you, Anna. Thank you.
Hi, everybody. My name is Anna Callaghan. I'm the Director of Services here at TLC, Talk, Listen, Change. Apologies to those of you who heard some of what I said the last time and then I got disconnected, but hopefully second time lucky, we'll get around to it today. So we are a relationships charity based in Greater Manchester, but covering the Northwest and a little bit further afield as well, doing a range of different services. Which there is, I think I've got a slide that gives a bit of context to who we are there. So I won't go through that, but we do have community services, counselling department, mediation services, and also domestic abuse services, which we've been running for over 15 years. The whole kind of ethos of us as an organisation is around the power of safe, healthy, happy relationships. but also in recognition that for a variety of reasons, not everybody has access to that circle of support. Sorry, just disconnecting from there. So not everybody has access to that circle of support. So our values as an organisation are authentic, safe and person-centred. And we want basically all of our processes and procedures within our organisation to encompass those things, living and breathing those values, living and breathing on a day-to-day basis, not only for those using our services, but also for people who work for us as well, so our staff and volunteers. And we want to see those values reflected in how we respond to people. And like many of us, we'll have a range of processes, policies, procedures to support health and wellbeing in terms of supervision, clinical supervision, and maybe wellbeing spaces. We've got our annual leave offer, and all of those additional things. Sorry, clicking, there's noise coming in from my computer. And some of you will have very similar processes in place for the kind of work that you do. For some of you, the work that you do might not need some of those processes. So looking into things like a domestic abuse policy, which I'm going to be talking about today, might be a bit new to you. So I did say at the beginning of the last time, and I forgot to say at the beginning of this time, although my heading was health and wellbeing, the kind of practice that I'm going to be talking about today is how we've implemented a domestic abuse policy. So if this is something that you might find upsetting or triggering, or if there's any kind of you just make sure you're looking after yourself in listening to this and gaining support if needed. So ironically, TLC actually supported other organisations in terms of looking at their domestic abuse policies before we implemented our own. As I said before, we have a whole range of safeguarding policies and procedures because of the nature of the work that we do. But we thought this year that we should formally adopt a domestic abuse policy to ensure that all of the information was there, very detailed and accessible easily. What we do know is domestic abuse can and does happen in all areas of society and in all relationship types. And when looking around your workplace or wherever you are really, important to remember that 1 in 4 women and 1 in 6 men have been impacted by domestic abuse. We've been delivering domestic abuse behaviour change programmes for over 15 years. And one of the things that consistently comes to mind for me is that there is no stereotypical relationship type or no stereotypical person or walk of life where for those that are using harmful behaviours. So it could very well be happening in your organisation. And having a response to that, I think, is really, really critical. The BBC reported last week, this week, whichever, if you heard me last week, it was last week. So the BBC reported about the levels of sickness being the highest that they've ever been in 10 years, or that they've been in 10 years. And that will be for a variety of reasons. But we do know that the impact of domestic abuse has huge impact on people's ability to attend work. And a report that was out, I think there's a slide, sorry, that has it, but a report from 2014, but that I'm sure resonates still today, and the figures are either similar or potentially higher, that 80% of victims of domestic abuse find it hard to engage with their work and may be absent for long periods of time. And more than 10% of those people said that the abuse can follow them into the workplace in terms of receiving messages or being stalked, or their partner or ex-partner physically turning up at their workplace. So not only can this be impacting people's ability to work or focus, but obviously has devastating and long-lasting impacts on their own potentially physical and mental and emotional well-being. Sorry, I'm just going to turn off. I thought I turned something off. I'm getting all these beeps, so I'll try and turn it off properly. So for us, when you're thinking about a domestic abuse policy, I think it's really important to understand that not only could you have people within your workplace who are experiencing domestic abuse, but you could also have people in your workplace who are worried about their own behaviour. And so having a policy that reflects options of support and disclosures of both kinds, I think, is really important. The first thing that I would say is about making your policy visible. So allowing people to know that you have a policy around domestic abuse raises the potential that people will speak up either themselves or on behalf of somebody else. Many people that are experiencing domestic abuse are isolated from their friends and family and don't have the freedom to engage in hobbies or activities or other venues of support outside of outside of the home. So work may be one of the only opportunities that people have to access support. Again, making it a really critical lifeline or option for support for people who are working for you. As absenteeism is something that it can happen quite regularly in terms of domestic abuse, for many people, the thought of losing their job, either through their sickness levels, anxiety, or the fear of people finding out what's happening, could increase the risk that they're experiencing in terms of potentially lack of their own finances or, again, space to be away from the harmful behaviour. So having a visible and well thought through policy hopefully increases people's confidence in your ability as an employer to support them and to understand what's going on so that they can feel open to discuss these issues with you. So what kind of things would we recommend that you would consider when creating a policy? Firstly, who is your policy there to protect and support? Is it just for people working with you or people using your services as well? For us, a lot of our safeguarding policies and procedure, risk management for those using our services are very separate to this as a domestic abuse policy relating to staff and volunteers that are working with us. I think the second critical thing to say is what is within your remit and what isn't. What we wouldn't suggest is for you to feel that you or any of your line managers or teams supporting your staff members should be specialists in supporting domestic abuse. That's definitely not what we're suggesting, but having people who have more of an awareness and understanding of how they can support, I think is really valuable. Figuring out confidentiality, so who needs to know when disclosures have been made, and a policy that sets out very clearly that if there is known relationships within the organisation, so if somebody's partner or ex-partner works within the organisation or knows somebody who does, if there's lines of communication outside of the normal line management route so that they feel that their space can be confidential and not connect with maybe personal relationships if they are there. Training for managers, I think, is one of the critical things that I would put into a policy. Again, saying what is and isn't possible for you as an employer. And for some of you, this might be kind of an area of work that you're really familiar with. For some of you, it might be very different. And so just again, really reiterating that we're not suggesting that you should be specialists in support, because in supporting domestic abuse, but knowing where the options are to transfer or to signpost people to, I think, is really important. So understanding what specialist support is in your local area or national support that you can refer people onto. Both people who are impacted by domestic abuse and those who are worried about their own behaviour. In terms of practical steps of a process, so I think I've mixed up. I'm not looking at my papers properly, so mixed up, but practical steps. So managing disclosures in terms of supporting staff, keeping accurate records and understanding confidentiality and how that is recorded in your systems. Recognizing signs of abuse, so along with the training, so increasing people's awareness and consciousness of the issue, so that everybody is aware of what they might be looking out for. But supporting managers to be person-centered around how they're supporting people if they have come to speak to them about it. Thinking about practical things like lone working policies. Sorry, I'm skipping again. Sorry, I'm skipping back and forth. So if I go back a step, but just in terms of how to support the training of managers when talking to people, is making sure that your managers or anybody who might be dealing with this doesn't make their own assumptions and is creating a really safe and confidential space for the person who's raising these issues or concerns with you to tell you their story. Not asking lots of questions in terms of the potential to re-traumatize somebody or asking them to talk about something that they're not comfortable talking about within that space, but having a space that's there and open for them to use in a way that is comfortable for them. In terms of practicalities, addressing things like expectations of workload, depending on the current situations and what might be going on. Some employers can support financially, some employers add. So we have some additional annual leave allowance in terms of special leave that we can give in these situations if people feel like they need some additional time themselves. Potentially changing in work patterns or shift patterns, another practical example. So we had somebody previously who has wanted to access one of our services but worked on shift patterns, and our behaviour change programme was a regular programme that he had committed to wanting to do, but had to go to his employer and tell them what was going on to be able to access a more flexible work pattern, so that he could commit and be held accountable for the behaviour change that he wanted to access. So potentially changing work patterns or the ability to be more flexible in terms of work patterns, potentially changing place of work for people, again, changing up either the shift patterns or the place of work so that there isn't a very regular pattern might be something that's really helpful. But again, not making assumptions about what might be needed from people who are coming to you asking for support. I think signposting and knowing the local area and knowing where the support networks are is really important. And I think there is a slide that will go out with this that has some of the national areas for people to make contact with, and then you could from there gain some additional information about local resources as needed. Some of the other aspects to consider are risk assessments. Again, I said about lone working, but your policy clearly stating what is possible and what isn't in terms of that, and having guidance around how that could be written, I think would be really helpful. Some of the barriers and challenges might be, so again, for some people, this might be an area of work that they're really unfamiliar with. So it might be taking people very out of their comfort zones. So providing support and advice and guidance for people who may come into contact with people who want to talk about this or who are accessing support, I think is really important. If you're not an organisation that already offers kind of clinical supervision or practice supervision or kind of that additional wellbeing support, then thinking about having ways of these conversations coming through, I think would be really important. In terms of the impact of this practice, it has the potential to be life-changing and to be a complete lifeline of support for people. Obviously, creating an opportunity where people feel that they're more supported, hopefully will increase their well-being within the workplace and their ability to complete their work, but also, and more importantly, for them as a person, potentially connects them to life-changing support that they might be able to access that they may not have been able to before. So there's a lot that I could say, and lots I could say depending if you're in an organisation that works in this context or not. And I guess what I would say is reach out if there is support that you would like in terms of thinking further about the kind of policy that you would like to put in place. Then, really happy to have a conversation about what that might look like and how TLC might be able to support or guide, kind of signpost you on to other people who might be able to. But I think the biggest thing for today that I would love for you to take away is just a consideration of whether or not this would be possible for you to implement, because showing people that you have this area of support and access to mental well-being, physical and mental well-being support for things that maybe aren't necessarily impacting the workplace, but very definitely impacting them as a person, I think is really critical. Starting to waffle on next. I'm getting to the end. So, but yeah, and I know we've not got an opportunity for questions because I wasn't here at the time, but you've got my email address there. So if you do have further questions or anything that we could support with, please do let us know. Thank you.
Thank you very much, Anna. I'm going to now hand over to Elaine Johnson from Great Places Housing Group, who'll be speaking to us about one of their people management practices. So over to you, Elaine. Thank you.
Hello, good afternoon, everyone. As Alexia says, I'm Elaine Johnson. I'm the Director of People for Great Places Housing Group. So we own and manage about 24,000 homes across Manchester, Lancashire, Cheshire and into Yorkshire, and we've got about 930 people that work for us. So yeah, as Alexia says, I'm going to talk to you about one of our people management processes, and I suppose it's specifically about that question of appraisals, to appraise or not to appraise our colleagues. I was looking at some figures from the IPD a couple of weeks ago, and they said that 65% of organisations still have appraisals in place, but only 80% of them believe that they are actually effective. And I suppose that's where we started from. We were in the 92% of not being sure how effective they were. And actually probably a little bit further than that, that we were actually in the place that they were not only not effective, but were actually sort of damaging some of our relationships within the business. So we started from, just go back one, we started from that slide on what is it the appraisal process is there to achieve, and how do we really capture the contribution of all our colleagues. And it's something that I think a lot about, that you know, all organisations know exactly how much money that they've got in their bank to be able to achieve their corporate objectives, but not many organisations actually know how much they've actually got in their people bank, their talent bank, that can actually deliver those objectives. And that's quite often where organisations go wrong. They might have the resources in terms of the cash and the finances to do what they want to do, but what they haven't got is that talent within the business to make it happen. And that's where we started from. So if we go on to the next slide, we were thinking about, so an appraisal process, what is it actually there to achieve? And where we came down to is actually the purpose of a good appraisal process, or the purpose of actually how we interact with our colleagues, is about how people get really great feedback that improves performance. And if you look at all the research on high performing organisations, the one determining factor is how good feedback is. And that's feedback in terms of recognising and praising and understanding good work and the achievement of objectives. But equally, that feedback that improves performance by thinking of different ways to do things, or giving people feedback when things aren't going as well as they could do, or giving people ideas and suggestions, and starting to really remove some of those barriers and frustrations. When we looked at our appraisal process, if we go on to the next slide, it was actually not doing that. It was a very, very overly complicated process. It was very much a tick in the box exercise, and it was very focused on, have you actually done your appraisal, as opposed to what has that actually produced. We were also measuring people against competencies, and our competencies were sort of the description of perfection in a particular role, but actually everybody achieves things in different ways, and that sort of definition of perfection was quite flawed. And we had some people that performed really, really well, but actually did it in their own way, not necessarily in this sort of defined box that we had of competencies. And similarly, we also decided that our definition of potential was flawed, because potential is quite fluid, and it does depend on people's roles and where they are in organisations, etc. And some of the appraisal process, where you had sort of high performing people, sort of split our workforce into those people that thought they were elite and some that didn't. It also worked very well for our office-based functions, but not particularly well for our tradesmen or people in some of the more transactional roles. So what we did was think about, well, what was really important? What did we actually want? And what we wanted was a system that really concentrated on the quality of conversations that happened between colleagues and their leaders, and that really sort of promoted a great conversation. We wanted a system that was agile and paper light. So it wasn't to be about paperwork, it was to be about that interaction. We wanted to really focus on outcomes and not the inputs of the competency, and focus on momentum. Were people moving forward? Were they actually achieving their objectives? Rather than thinking about, you know, not what was being done rather than how it was being done, etc. And we also wanted sort of a way of measuring in the organisation everybody's individual contribution, and really understanding the value of people within our business. So Where we moved to was great conversations, and this was really highlighting those one-to-ones that all our managers have with their colleagues within the team, and making them the focus. So we concentrated on 3 things, and that was turning the conversations, those conversations that are happening every day in our business, into being really, really purposeful and powerful. So we started with these 3 Ps. Being present. So being present was very much about right conversation, knowing your audience and making sure that people were being present, being there, really listening, and you're really using the conversation well and sharing the space, making sure that it is a conversation, not a one-way street, one way or the other. And these next few slides, I'm not going to go through them all in detail, but they just give you a little bit of an idea of what we were thinking about with our be present, be purposeful, and be powerful. So we have one that describes what it means, and then the second slide is how managers prepare for those conversations and colleagues in terms of planning to be present. Purposeful, that's all about really starting with the end in mind, thinking about what is the purpose of this conversation, what do we need to achieve, and really focusing what is the most important thing that we need to talk about today. Let's not have the conversations that don't matter. Let's have the conversations that really do matter and move our business forward. So this is the being purposeful one, and the next one is planning to be purposeful. And then the final one, and potentially the most important one, making sure those conversations are powerful. So making sure they make a difference, that something happens as a result, that we're not just talking about things, but we're putting things in place to make sure that action happens and things are achieved as a result. So this is our being powerful one, and the next one is how we plan to be powerful. So we went through an organisational training programme where we trained everybody in great conversations. So that was our leaders and managers, but all colleagues, they all went on the same training course to really start highlighting the importance of the conversations that we have within the business. So the next slide is the question of, so what? So what happens after we've had these great conversations within the business? And what happens is each manager on an annual basis meets with our HR team and our people development team to capture the outcomes of all those conversations that have happened over that 12 months. So we talk about each individual, we really focus on each individual, what their contribution is, what they've achieved against their objectives, how they've achieved it, what their real strengths are, what are the areas that they're developing in. And we also think about their career aspirations, what are their next steps, and also succession planning. So, you know, are they a flight risk? If they are a flight risk, what do we need to do? And if they were to go, what's the succession for somebody else coming into their role? But equally, what succession plan are they on if their career aspirations is to move forward? As we go through those conversations with each manager, we actually then think about what that means for us. And we have 4 categories that we put people in loosely at the end of those conversations. And that's just really to get a measure of our talent pool within the organisation. So the 4 areas are valued. So that's a person who is really good at their role, that work to a high level, they come in every day, they're reliable, they really deliver, they're a solid performer, they're very well motivated, they're engaged, and they really, really perform. And my killer question on this one, and we do have a question trace that we go through in all these meetings so that we do flush out all the information, but my killer question on this one is, knowing everything that you know about them, if they were to leave tomorrow and then asked to come back, what would you say? Would you re-recruit that person? And if the answer is yes, you've probably got somebody that's in that green box and you've got that very valued individual. If there's a bit of a hesitation, that's probably the time to have some more discussions about what was the hesitation, what's the issue. Our orange category there is highly valued. So these are those individuals who are actually the real magic within your business. Those are the people that go above and beyond and deliver something that is unexpected, that's over and above their job description, that's a real bit of that sort of wow, a bit of the X factor. And for somebody to be in this category, there has to be something that is very, very tangible that we can say is over and above that job description. So it's something that actually makes a difference to our bottom line. So that might be that they thought of a way of doing something that is much more efficient and saves the business some money. It might be that they go out and bring some new business in. It might be, and that's not just as part of their job role, that's something that is over and above and unexpected. It might be that they have create a partnership with another organisation that brings really massive value back into the organisation, or it might be just something that they do that actually means that everybody that comes into contact with them gives us that little bit extra. But it is quite a high bar to get over, and it is something that has to be quite tangible. These are the people that, I mean, we all talk about when people leave, can we replace people? And in 9 times out of 10, yes, absolutely we can. And it's that old analogy of, you know, if you take your hands out of a bucket of water, do you notice the hole? Those are your valued people. Your highly valued people those are the people that when they leave, they take something that you can't replace, some little bit of magic, and actually you do feel it, that there's something that has been lost to the organisation when they go, because they are those real special performers. The blue category is our developing people. So those are people who, and you can only be developing under our scheme within the first 2 years of employment. And it does depend on the job role as well and the complexity of it. But those are the people that are still learning and they're still growing into their role. They're developing. All the indications are that they're going to make it to be valued or highly valued, but they're just in that developing situation where they're not actually giving you 100% because they're still in that learning mode. And our red people, those are our performance issues. Those are the people who are not performing. Now, in some cases, these people will be people that actually do their job, but the issue is some of the baggage that comes with it. So quite often when we have these conversations, it's more about the sort of attitude and impact of those people as opposed to the actual what they do in their day job. So if the issue is about capability, we can always look at training, we can look at how we develop people and how we support them to become either valued or highly valued. But these are the people where there is that barrier. And quite often when we sort of delve into this and talk about it, it tends to be those people where their personal values are not aligned with the organisational values, and it just becomes a bit clunky. They're not bad people, there's just that sort of clunkiness within the organisation. And it's just something that's not working well for them. And that's what we explore and try and get to the bottom of in those conversations. So once we've been through that process, what we then look at is thinking about the value of that. And if we click onto the next slide, we have a system whereby for each of those people in those roles, no, go back one, it's the people in those roles, we put a cost to it. So anyone that's valued, so those are those really good people that are absolutely performing. In our model, they are cost neutral, and that takes the view that whatever we are paying them through our job evaluation processes and our salary structures, etc., whatever we're paying for them, they are cost neutral. We are getting value for money. We are getting that value back into the business, so they're cost neutral. Our highly valued people, if you look at all the research and CIPD research, what it says is these people that actually give you all this extra, the discretional effort and that sort of little bit of magic, can add up to 30% of their salary to the business performance. So we don't take the full 30%, we actually calculate these people at 20% of their salary. If we go on to our developing people, where we've got developing people from the day they start through until the day that they are valued or highly valued, on a sliding scale, they are not working at 100%. So we calculate those people at minus 15%. And that takes account of the time that they are taking through induction and learning. And even in those sort of first few months as they're joining the business, they might be a bit slower, they might make some mistakes, they might not see the opportunities that a really experienced and competent person would. So they're calculated at -15%. And the sort of -15% of the salary is seen as the investment we're putting into that person to get them to the valued or highly valued level. The really interesting one is the actual impact of our performance issues. And again, going back to all the CIPD research, that suggests that where you've got somebody in the organisation that isn't performing, it can actually cost up to -40% of their salary. So we'll go on to the next slide. We got the next slide, which is there we go, -40%. So that 40% is made up of the sort of issues that person can cause. So it might be sickness, it might be disciplinary, it might be the impact that person has on their team, because they might be very negative, they might cause issues in interpersonal relationships, they might really piss everybody off, and that has an impact. It also takes into account the manager's time dealing with those sort of issues, but also, well, the manager's spending time with that individual, they're not spending time with their valued and highly valued people, which actually might bring more benefit to the business. But when you look at it, it does have a big impact. So what we do in each area of the business is do these calculations. So if we move on to the next slide, I've done just a quick calculation to show how it works. If you've got an organisation of 100 people and the average salary is 25k, if you've got 15 highly valued people, then their contribution to the business is 75,000. Our valued people are cost neutral. Our developing people, well, as I say, we've got an investment there of 15% of their salary for each of those people. So our investment there is 18,750. But our performance issues, if we've got 10 of them, and that is costing about 10 grand per person in terms of what it's taking out of the business, that's a net of 100,000 that's coming out of the sort of business. So you can see there, if that's the way that it works, the net result for that particular organisation from their payroll is that actually you've got a minus £43,750, which is actually, that's what it's costing you in terms of that performance. So if we go on to the next slide, what that looks at is if you take a normal performing business in terms of where those people are distributed, from your excellent people on the far right hand side through to really good valued people, your developing people, and then your performance issues, you'd expect a normal distribution curve. But where you've got really high performing organisations, those are the people that have pushed their curve to the right. So some of the great conversations, the feedback that people are getting in the business is actually moving people into that really valued and high valued space, and they are really contributing to the business. They're also tackling their performance issues, and also with their developing people, accelerating their development through their induction procedures, their training procedures, the support they get from the managers, so they move into valued or highly valued at a quicker speed. Your low performing organisations are those that are where the curve has shifted the other way. So actually what is happening there is they are tolerating poor performance, they're tolerating their performance issues. And what you find in those organisations is where poor performance is tolerated, then some of your high performers move on, because high performing people and those really good and excellent people, they don't stick around if they see their organisation not dealing with some of the poor performers. So what we do in our business is we can pull that curve for everybody that works here, but we can also pull it on a directorate basis and on a team basis, so we can understand team performance. And I think it's my final slide now. If we click onto that one, what's been the impact? Well, one of the real things that happens in this process is it's really energizing, because the focus is on the colleagues that really add value. From my point of view as a HR professional, our HR team used to spend a lot of time dealing with our performance issues. What we do now is really concentrate on those valued and highly valued colleagues and really think about them and spend time with them. It gives us total clarity on our performance and capability issues, so we know as a collective within the business who are the people that are taking the business forward and who are the people that are holding the business back, and what we need to do to actually either get them on board or potentially look at ways in which they can move to other organisations which might fit their personal values, where they will perform in a better way. It gives us a collective understanding of where contribution is coming from the business, but it also measures our value for money of our payroll. In the housing sector, we do a lot of work on value for money, and we look at it in all aspects. But one of the things that's often missing is, are we actually getting value for money from our salary bill? And this gives us, it's not ideal, it's not perfect, and it's not, you know, it will never be a system that's absolutely exact, but it does give us that view. And it gives us a way of pulling through our learning and development needs. So it's our training needs analysis for the business, and it also creates our succession plans. So that's all I was going to talk about. So hand over for any questions. So I hope that was okay. If anybody, I've gone through it very, very quickly. I put a lot of information on the slides because I presume we're going to circulate those afterwards if anybody wants to have a look at it. And obviously, as the others have said, if anyone wants to contact me about the system, feel free. Thank you.
Excellent. Thank you very much, Elaine. And thank you to all our speakers today. I know that Anna was having some technical issues before, but I think she is joining us on the call. Does anybody have any questions at all? Please do put them in the chat, or we are happy to put you on video and microphone if you'd like to ask any of our speakers about their practice. See if there's any questions in so far. No. So after this webinar is over, you'll automatically get a copy of the slides. We do have a summary document as well, which will be uploaded onto our website. So you'll be able to download the slides, the recording, and this summary sheet, which just has the 3 practices on to kind of help and inspire your own organisation. If you've enjoyed this webinar, please do connect with the speakers and tag us on social media. It helps spread the word about the Good Employment Charter and our movement in Manchester. I think that's all I had to say for now. Just check if there's any questions. No, lovely. So thank you again for everyone for attending, and a huge thank you to our speakers. That was really inspiring and always great to share good practice. And we hope to see you all next time. Cheers. Thank you. Goodbye.